Hi, I'm Professor Saiendhra Moodley. I am the head of public health at Nelson Mandela University in the Eastern Cape in South Africa. I am also the president of the College of Public Health Medicine in South Africa, and I serve on the Congress Management Committee for the World Congress on Public Health 2026. If I had to choose one word with respect to my hopes for the 18th World Congress, I think that word would be success. And I'm thinking of this from the perspective of a member of the Congress Management Committee, as well as somebody that has worked in the Public Health Association of South Africa for quite a while, and as well as being a former president. There's been work done over many years within PHASA, the Public Health Association of South Africa, building towards an event such as this. And that work actually predates the awarding of the Congress to South Africa. So there's been lots of time and effort by many colleagues within the association in South Africa. And it's critical for us that this event is a success. And what does success look like? I think it's an event that strengthens PHASA as an organization, leads to new partnerships, builds on existing ones, and I think particularly elevates the public health work being done in South Africa and the rest of the continent, and creates momentum for advancing the role played by PHASA both nationally as well as within the global public health community. And in terms of what change would look like post the conference, I think it means conversations at the conference have translated into real collaborations and practical action. In particular, I think I'd like to see post the conference greater collaboration between countries of the global south. Over the last couple of years in South Africa, we've started to work more closely with our colleagues in East Central and Southern Africa. And I think the conference presents an opportunity for us to build on this work with countries in the region, creating new partnerships, new research questions being pursued, and then also creating stronger links between evidence and policy, and a shared commitment amongst all of us to strengthen health systems in Africa and globally. I think it's incredibly significant for the members of PHASA as well as for the African Federation of Public Health Associations to have this World Congress on African soil. It is the first one in Southern Africa, and it provides an opportunity for African public health professionals to showcase their work, shape the global public health discourse, and obviously build international collaborations. I think purely from a logistical point of view, it has created the opportunity for many more African researchers to attend a World Congress than otherwise would have been the case if it was held on another continent, by reducing travel costs. We've also tried within PHASA, as well as the Schools of Public Health in South Africa, the College of Public Health Medicine in South Africa, as well as the East Central and Southern African colleges of public health physicians, to actively market the conference. And I think that has been reflected in the number of abstracts received from South Africa and Africa. There will be a substantial number of organized sessions from Africa, which is a great opportunity to showcase the work being done on the continent and to find some solutions to critical public health challenges on the continent. We also will encourage our members to organize pre- and post-conference events to really maximize the opportunity to engage with the global public health community. There's obviously going to be a diverse range of participants at the conference, and I think particularly from a personal perspective, interested to hear about the public health work being undertaken in countries of the global south. I think in South Africa, we do have a sense of the work that's going on in the rest of the continent through our existing partnerships, and in the US and Europe through the media and through scientific literature, but particularly interested in countries and organizations from Latin America and Asia, approach to implementation of public health interventions, and the success stories in building resilient health systems, often in very challenging conditions. I think there's enormous practical wisdom in those experiences and many lessons to be learned. I think there are a number of avenues for attendees to actively contribute to the discourse and leave their mark on the World Congress 2026. I think particularly by sharing their local experiences, both their successes and failures, where I think participants from around the world can learn from, asking challenging questions, and engaging with colleagues outside their usual networks and colleagues from other countries and continents. I think some of the most valuable ideas will emerge in informal discussions and collaborations. And I think the critical part is to actively participate in sessions, both the oral and poster sessions, as well as the many organized sessions during the conference. If I were given the microphone for the final keynote, I think I'm going to mention two different issues. I think firstly, a call to action around protecting health and human life in times of conflict. I think the situation in Gaza over the last few years is a major public health issue, which I don't think as a community we've really spoken with one voice. And I think that's critical to protect health systems in conflict zones, ensuring humanitarian access, and the fundamental right to health for all people. The second issue, I think, is for us to reassert public health values and to address the attack on many public health gains that have been made over decades and centuries. I think an example of this is the growing anti-vaccine movement, which I think as a public health community, we're failing to adequately address. So I think a renewed focus on effective public health advocacy would be an important outcome of this conference.